Hello, this is Dr. Meral Ramahi reporting to you on UR 2021 from Cleveland, Ohio for Room Now. There was a lot of great content at the virtual UR this year. Amongst my favorites was presentation ID 6882, and it was titled, "What Should I Tell My Patients with Rheumatic Medical Diseases About Diet?" It was by Dr. Elena Nikiforou. So we all can easily acknowledge the importance of the exposome, or the totality of exposures that individuals experience over their lives and how those exposures affect health. Specifically, we know that nutrition plays a role in inflammation in rheumatic medical diseases and comorbidities. So what you eat matters. This is a topic that I love because I feel that advising patients on an anti-inflammatory diet helps empower them, and they are often excited to take on the role of a team member in the road to low disease activity achievement. It gives them a sense of control to know that they can implement lifestyle modifications in conjunction to pharmacotherapy to help achieve low disease activity and decrease comorbid diseases. So I felt like it was worthwhile to highlight the key lifestyle modifications that we should portray to patients as demonstrated in this presentation. So what is an anti-inflammatory diet? Simply, it is a diet that is low in added sugar, high in fiber, low glycemic index foods, low in saturated fats, high in monounsaturated fats, high in omega-3 fatty acids, and high in phytonutrients. There is evidence that a Mediterranean diet, omega-3 supplements, raw fish consumption at least 2 times per week, and daily intake of seeds and walnuts benefits RA disease manifestations, including arthritis, pain, function, and the comorbidities. So what about red meat and rheumatoid arthritis? So red meat is thought to be inflammatory and should be consumed in moderation. In countries where there was increase in consumption of red meat, the prevalence of RA was higher. Admittedly, though, a causal relationship cannot be established because there are multiple confounders, but patients should limit red meat intake to less than 2 times per week. Should patients with rheumatic disease limit coffee intake? At least 4 cups of coffee per day was linked to an increased risk of development of seropositive rheumatoid arthritis, with a relative risk ratio of 2.2. Other studies show that there is a risk of rheumatoid arthritis regardless of the amount of coffee you drink. So what should we advise our patients? We should advise our patients to drink coffee in moderation, definitely less than 3 cups a day, with a preference for green tea, is what this presenter recommended. So should we care about vitamin D in our patients with rheumatoid arthritis? Vitamin D deficiency is associated with increased disease activity and low chances of remission and response to treatment in rheumatoid arthritis. So we should be checking vitamin D levels in our rheumatoid arthritis patients and supplementing as needed. What about obesity and rheumatoid arthritis? Is obesity linked to rheumatoid arthritis disease activity? Yes, the higher the BMI, the worse the disease activity. Further, we know that the obese patients have a harder time achieving RA disease remission compared to normal or overweight patients. So what about exercise in our RA patients? Walking 3 times per week for 30 minutes on the treadmill in older adults with stable rheumatoid arthritis is associated with a decrease in disease activity, an increase in innate immune functions, and an increase in cardiovascular fitness. This is a must-see talk at UR. Please tune into Room Now for more great coverage of UR 2021. I'm Meral Ramahi.